Happened to Me, a rare disease and medical challenges podcast. The mission of our podcast is to support you, our listeners, and to create community as you confront the toughest challenges in life. All of us will experience health hardships. The real question is, how do we adapt? That's the focus of It Happened to Me. We help you overcome limitations and live a full and satisfying life. Drawing on their own health challenges, hosts Cathy Gildenhorn and Beth Glassman interview guests who share stories and research to help you succeed in the face of difficult health obstacles. It happened to me. I'm not alone, and neither are you.
This episode of It Happened to Me has been split into two parts due to the length of the interview. Part 1 follows.
Today, our guests are Bonnie and Will Alms. Bonnie and Will's son, Everett, has been diagnosed with Bardet Biedl Syndrome. This syndrome is an extremely rare genetic syndrome. People may suffer symptoms that include retinal degeneration, obesity, reduced kidney function, extra digits of the hands or feet, as well as many other manifestations. Thank you for joining us today on It Happened to Me and sharing your story.
Thank you so much for having us. Sorry.
Yes.
Absolutely.
We're thrilled you're here. We're thrilled you're here. So let's start at the beginning. What is BBS?
Oh, it's a ciliopathy. So I don't know if so cilia are part of what dictate where a cell goes and how it functions. And so unfortunately, it affects every system in the body, head to toe. You could have epilepsy. Our son has epilepsy. He 2 little holes in his brain, but those we recently found out aren't the source of his epilepsy. But anyway, epilepsy, vision, malformed lungs or malformations anywhere and everywhere, kidney function, cardiac malformations, everything, liver fibrosis, hypotonicity, like they don't have much body tone, and then the stomach. Hyperphagia. They're constantly hungry. Think of the hungriest you've ever been in your life, and where you just are like, okay, I thought of this like when I was driving home one day and I didn't get a chance to eat lunch at work or really even drink much. And I'm just like, okay, when I get home, I'm going to eat this and I'm going to eat this and I'm going to eat this and I'm going to eat this. And of course you don't eat all those things. But somebody with hyperphagia is going to try to eat all those things. And then their stomach's going to hurt, but they're still going to be hungry. And they're going to still keep eating, even though it hurts to eat.
Right.
They never get full, ever. And then the body is in this state of starvation where it's like, it takes all the nutrients that it's absorbing and immediately deposits it. So because it's like, I'm never going to see food again. So I'm going to hold on to this and put it right here where I can get at it easily. So they do have a disproportionate, even though they can have morbid obesity, it can be disproportionate around the abdomen and thighs, just where the liver's like, hey, I'm going to keep this handy.
Because physically they are in a state of starvation and always depositing. So any kind of nutrients, I mean, it just turns into fat right away.
Yeah.
So it's very similar to Prader-Willi. I don't know if your listeners know of Prader-Willi, but it's very similar to that.
Yeah. That's a much more common disorder.
That's the disorder I thought of when I started researching, and even in grad school when I was learning about this disorder, I was like, wow, this has a lot of similarities to Prader-Willi, which is also, is that still considered a rare disease? Like in my world, it's more common, but
I don't know.
It's still
like
considered a rare
1 in 20,000
disease.
kids.
It's a little bit more common.
It is more common.
And running rare disease, I mean, it runs the gamut, right? I mean, how do you find, where do you stop calling something rare? for us, I think they did, the calculation is 2,500 people affected with Bardet Biedl syndrome in the United States.
I see it
But
all over.
yeah, but it's, you're only as good as
how many people
how
of.
people
Right.
report. Yes.
Right,
How many people
exactly.
would self-report.
I
Exactly.
think there's a lot of people out there that have BBS and don't know it, especially people who are over the age of probably 40.
And not to mention, it's probably underdiagnosed, right?
Yeah, I'm sure that's true.
When we got diagnosed, I mean, we were seeing a geneticist out of University of Minnesota, and we didn't catch it. They didn't catch it until he was 5 years old, right?
Mm-hmm.
So arguably a really great healthcare system.
Yeah.
In a major metropolitan area, and
Yeah.
they didn't catch it. But
well, and
I was going to
had
ask you. So if we go on your journey with your son, so during your pregnancy, was there an abnormality that was seen at that point in time? Yes.
Yeah.
And what did your OB say?
Well, that 20-week ultrasound that everyone gets.
Yes.
They said, oh, his kidneys are kind of bright. And I'm like, oh,
right.
What does that mean? That just, they don't want to scare you. So they say, oh,
Sure.
it just means it's probably nothing, but we'll just have you follow up with a perinatologist just to rule it out that everything's fine. And
so you followed up.
We did. And there was an appointment scheduled for us with a genetic counselor immediately after the appointment. And I said, why? And they said, well, just in case. I'm like, just in case what?
Of what? Yeah.
Yeah. And just in case something were to be found out, then you can talk with somebody right away who knows things. So we went to that appointment. It was a couple of weeks later.
Yeah, I was going to say, was that 22 weeks?
20? I don't know if it was 22 or I don't remember exactly. Right. I know the date.
Right.
We know the date because we
1st.
celebrate it March 1st every year. It's coming up.
Yes. Yes, it is.
So on March 1st, 2006, we went in for that ultrasound that we were going to be just ruling out anything. And she said, let's just take a quick sample of the amniotic fluid. But she's like, really, it's already too late to have an abortion in Minnesota. I can offer you.
Oh my goodness.
To go to another state.
She said that to you right then at that appointment.
Mm-hmm.
Yeah. Oh my. Just like that.
Oh my.
Not prepping us.
Right.
Oh my.
And she said, why would we do that? We tried so hard to get pregnant.
Right.
Yes.
And she said, this baby will never see a year. It may not see 30 minutes.
And this was the genetic counselor or the OB?
No, this is the perinatologist.
Perinatologist. Okay.
Yeah.
Right.
And we said, well, we'll hold our baby in our arms for 30 minutes then. And
what they had seen was, or what they explained was the kidneys being hyperechoic.
So that's the brightness.
Hyperechoic means
hyperechoic. Yeah. So like when they send the sound waves through in the ultrasound, they bounced back. So meaning there's more density. So kidneys aren't supposed to be so dense. And so they thought that denseness was cysts. And so they were thinking immediately that he had intra or prenatally diagnosed polycystic kidney disease, which when you're diagnosed as a child, you probably have a shorter lifespan. Diagnosed as an adult, it probably, your lifespan is going to be normal. But my understanding was if it's diagnosed prenatally, you don't have good odds.
Right.
And that makes sense because that's
when
more
the
common.
amniotic fluid came back, what did they tell you?
They told us he didn't have three different disorders. So, because that's all they could test for at that point, is they called it a fish. I think you would, I know that.
Yeah.
More
So
than,
fish is kind of where they take the way I explain it to patients is kind of like, with glow sticks, how that, glows in the dark. So it's kind of in my mind, similar to using like glow in the dark paint that you throw on the chromosomes or the DNA, the cells, and see, okay, how many are lighting up, so you can count, is something present, not there. So yeah, it makes sense that they were testing for the disorders that they were on their mind, on their differential diagnosis that they were suspicious for at the time.
Yeah. So pretty much.
So what did they think?
Well, we didn't know the results until after. I mean, it was a couple. I don't remember how long it was after that.
Days, right?
Right.
That we would have known.
Yeah, I mean, I don't know, it was days or a week or whatever. But so we left that appointment. We talked with the genetic counselor. I don't even remember what we talked about. Other than the other things that they found on the ultrasound was that he had extra digits on his hands and feet.
So that means extra fingers and extra toes.
Yeah. So he had his extra finger was just the last part of like a pinky, and it had a nail and a bone and everything in it, except it was only attached by like cartilage or something. I don't know how. I was always terrified that when I was putting on his arm through a sleeve, I was going to tear it off, or I'd wake up some morning and it would be twisted and just come off. I don't know.
Right. It wasn't working. It was just kind of.
Yeah. He couldn't control it. It was,
I see.
Right.
But like his extra toes on his feet were fantastic. It was a fully functioning extra toe. So like the knuckle, so imagine your pinky knuckle being two heads, having like a double knuckle head. And then the bone for that metatarsal being extra wide. And so then he had two pinky toes essentially. And I don't know, it was great. He was a summer baby. He was born in June. So we'd be at the grocery store and I wouldn't have socks on him. And people would do the double take of, that's a lot of toes.
Right.
you know. But
did they give you any sort of diagnosis?
No, nothing.
No, absolutely
no
not.
Diagnosis.
No,
but there was something wrong. They told you there was definitely
something wrong,
and some abnormality.
We didn't know how long he was going to live.
Right. And how did you cope with that?
Well,
hearing that news, the two of you definitely seem bonded, and I feel that you two are really supportive of each other, but you're facing a life tragedy. How did you handle that?
Oh, well, he and I are opposites. So that's why we fit so well together.
Right. She's more the scientist and I'm more the artist.
He's the artist.
So we kind of fit together that way.
Yeah. So we went to we found a grief counselor, a reproductive, a counselor who specializes in reproductive grief. So
wow,
parents who lose
what a
babies.
Great idea.
Oh yeah. I mean, she was amazing. She was amazing. And so parents who lose babies or have like this situation where we don't know if our baby is going to live or not.
Well, we were still grieving.
We were still grieving.
Yeah,
he was
of
born,
course.
Yeah, because we didn't know. We had no idea. And at this point, we were in the process of setting up, or mostly done setting up his nursery. And people had baby showers set up for us, and Bill just wanted to cancel them all. And my mom's like, oh no, I have people coming from all over, to celebrate me having a grandbaby. I'm the late in life accident. So she is so excited to I have older brothers that are 11 and 13 years older than me. So actually I have nieces and nephews that are just a couple years younger than me.
Yes.
And she has a great grandchild that is less than a year younger than Everett. So, but she was so excited to like have a grandbaby again, to be grandma again. And yes, she absolutely wouldn't cancel. And we didn't really know how to deal with that either. Like, what, you're supposed to be happy at a baby shower, not tearful.
Well, we did. You especially celebrated.
I did. Yes. I always hang on to the positive. There's no matter what in life, there's always something positive. And so I had a t-shirt.
That's where you are. You are so strong and have such fortitude.
Well, you have to. Yeah. You have no choice. People say that. They're like, oh my gosh, how do you deal with that? It's like, well, you do, just because you have to is how you deal with it. And sometimes you don't deal with it. Well, sometimes you just break down and cry and sit in a corner, and that's just how it is.
Human.
But yeah. So
plus, I think
the good family support. It sounds like tremendous family support.
Yeah, we really did.
Yes.
And you were very emotionally strong, and I think part of that is you're also carrying Everett, right?
Yes. Yeah, I had my baby.
The emotions, if you let that.
Right. You don't want to, I didn't want to be sad and have that affect my child somehow. I have no idea how all that works. So I didn't want to take the chance, just in the same way that I'm very particular. So in the same way that I had I had a little book I carried around with me to make sure that I had I had at least one fruit, and I had this, all my servings of fruits and vegetables every day. And then something had to be a different color. Something had to be raw. I'd have to check my boxes every day, and I'd have to walk, this far, every day. And just to make sure I was doing everything I was supposed to be doing.
You did everything right.
So,
tried.
Yeah.
Yeah.
But so I had this t-shirt that said just kicking, and it just had, 2 baby feet. And so we took out a marker and just drew on extra toes and, just did little things like that to celebrate, our baby
Sense
and
of humor.
his uniqueness.
And then we corrected people too, as long as the baby's normal.
Right. People always say, as long as the baby has 10 fingers and 10 toes. And I'd say,
what if he doesn't?
What if he doesn't? You're still going to love him.
Right.
Or they say, well, as long as the baby's healthy. Well, really? Then you're not going to love him if he's not healthy? No, you're going to love that baby, healthy or not.
That is such a good point that I hear from patients over and over, because that's just something people say, really. One of those things we've heard our parents say, and really, and I really want to be part of rewriting that quote and just saying, I don't know what would be to replace it, really, but to just take that out of our language, really, to say I hope that, your pregnancy symptoms are minimal or something like that. Oh, I hope nausea is okay, or something that's a little bit more maybe focused on that pregnant person or something. I don't know. I'm kind of brainstorming in the moment. But go ahead, Will.
Go ahead. No, go ahead.
Oh, I was just going to ask. So fast forwarding a little bit. So obviously Everett was born, you brought him home. And so
he lived.
He lived. Spoiler alert. Fantastic.
So I will say that I think it was the following year that we said, oh, it's March 1st. And we're like, well, now it's been, he hasn't made it to a year yet, but so we started celebrating March 1st as, I don't know if it's okay to say, but Screw Stupid Doctor Day. So
no, you can say that.
Okay.
Yep.
And it's not that doctors are stupid, but in this case, they were being overly cautious, and we almost lost our baby because of it. So, we celebrate.
It's a lesson to healthcare providers listening, because we do have a lot of them that don't say or quote numbers that are not backed by recent data or that you really feel comfortable with. I mean, we see this a lot for even more common conditions like trisomy 13, trisomy 18, that, you know, people say, oh, this is a lethal condition. It's a life-limiting condition. It's not lethal. So, you know, it's things like, yes, there's a much higher chance for a lot of, you know, negative outcomes. But yeah, it's like, I wish that people would step back, because as a genetic counselor, when a patient asks me a question and I don't know the answer, do you know how many times I say, I don't know, let me do some research and get back to you? That is like, I should have a button in my office, because I say it so often. And, you know, it's like, to say something that's that detrimental to even just your mental health at the time is just, it's just very heart-wrenching to hear that you had to hear that.
I think that Everett, with these two parents, had the best shot in life. There's no way he was given up.
Right.
Oh, no.
Your vibe.
Absolutely.
There's
He was
no
not, no.
way. No.
I often say,
survive.
right. I
He's going
often
to
say
survive.
that thank God Bonnie is Everett's mom.
Yes.
Right.
I was thinking the same thing.
I mean, she's in the field, right? She works with doctors, she works with providers, and a lot of the things, I can point to a dozen things of where she didn't take what the doctor said at face value. Where I think a lot of people like me
I'm
probably
taking out
would.
a hanky. I'm taking out a hanky. This is a hanky moment. I really believe that you two are just marvelous. I'm sorry to interrupt, but I'm
so
filling
much.
up with tears.
You know, I think a lot of people, a lot of lay people like me need to understand that, you know what, doctors will say certain things, but they don't know everything. And to your point, Kira, you know, I don't know, to your point about
never give up.
Never giving up. Yeah.
Never.
Well, and questioning. I question, and it's the same thing. That's part of my personality though, too, is what are your resources? What are your references? Show me your references.
Show me the data.
Show me the data.
Right? Yeah.
Yes.
And if that paper was published in 95, you're like, is there a more recent paper? Sometimes there's not, if it's really rare, but and also that when I'm talking to patients, I can say, well, here's some scientific information, right? Like, this is what I've been able to learn. But in most cases, if it's rare, if it's kind of, you know, not Down syndrome or something, I have not met a person that has this condition, right? So I'm coming from it from the medical terminology, the science, you know, we're looking at screening, testing. But something that I always make sure to include is I have never had this condition. You know, even for me, it's very relevant. I tell patients I've never been pregnant before. So there's only so much that I can relate to. And that it's so important to hear from a patient advocate, either that has the condition or is a caretaker for someone that has a condition, like you guys as parents. And there's been times where patients say, well, can I talk to one? And so then I do my networking and find someone, because I can answer like what I learned in grad school, right? For BBS, but I can't speak to the daily life. I can't, you know, so, you know, in the future, I'm sure I'm going to be like, hey guys, do you mind, you know, would you be open to talking to these patients? Because you're the experts on the condition. I'm expert on general genetics, but I can't speak to this, right? And I think that's where healthcare providers need to understand the limitations there, but also for patients to ask, can you connect me with someone that has this disorder? Help me find someone. I love when patients ask me that. It's so important. I can't give them that information.
It's so much more than just the science. There's so much in it in terms of just grasping the lifestyle of living it.
Yeah. And, oh my gosh. So many stories I want to tell you right now, but I have to try to think in chronological order. So I'll try to abbreviate it. So we were told by the genetic counselor in our journey of trying to figure out what he has. He has something. We just don't know what. And we're climbing through family trees on both sides, trying to find any relative with extra fingers or toes, any relative with kidney issues or dysfunction, and can't find anyone. And
this was the geneticist at University.
Yeah, at the U of M. And she was fantastic. She still is fantastic. And so her theory was that it's just something that probably is so rare that it isn't a syndrome yet, or it's a syndrome that doesn't matter because it doesn't have anything horrible associated with it. So, let's just live life and see. Right. And that's how we felt. Let's just live life and see. So, we took
but through that
day, week, month,
right,
year as it was, and celebrated each and every part of it.
But through all that, I think there was a lot of, well, what's next? Right. Mm-hmm. Different things cropped up.
Yeah.
Right? He had a very traumatic seizure at 20 months old.
Oh my.
Where he
died.
He was lifeless.
He was pulseless, breathless, blue, mottled. I was laying in bed next to him. Thank God. We had just moved into, not just, but we built a home.
Months.
This is the home that we're living in right now. And so we didn't feel like we should set up a crib. So we just threw a twin mattress on the floor in the corner. And then I would sleep on the side. And when he was sick, so he had fevers, and when Everett does anything, it's either enormous or not at all.
Go big or go home.
Yeah. So if he gets a fever, he's going for 104, 105. He doesn't mess around with this 101, 102 business. He goes big or he goes nothing. And when this kid had a seizure, he went big.
Yeah.
Oh my.
And I'm standing there holding him. He's dead. I'm crying. I'm sobbing so hard. Bill's on the phone with 911.
Oh no.
I'm just, again, my hairs are standing up. This is, that's right. Because
dead of winter was a very snowy and cold.
It was February. And you had come home. He was sick. So you gave him a neb while I was sleeping next to him. And after you went to go lay down, go to sleep in our bed, Siri, don't be calm. And so you had gone to lay down in our bed, and then about 20 minutes after that, he just started bouncing. I mean, he was bouncing off the bed so hard. I mean, so high. He was bouncing a foot off the bed. And then after that stopped is when he was his face was all blue and veiny and mottled, and his whole body went blue. And so I'm holding him, screaming, crying. Bill's on the phone with 911. And
I'm thinking in the back of my mind, I mean, she's again in the business. I mean,
I'm a hospital pharmacist. Right. So I have my doctorate in pharmacy. And I'm on the code team at a level 1 trauma center. We're a stroke center, magnet burn center. We were the first hospital to be a pediatric trauma center, even before children's.
Wow.
So know more than the average parent while this is happening.
Yeah. Right. Yeah.
Is there medication that you can give for a seizure?
Yes, there is
a rescue med,
but he had never had seizures or anything before.
Right. So
you didn't have access to anything, right?
No.
And I'm hearing 911. I'm, explaining that he's having, they're kind of figuring out that it's a seizure, and just to kind of keep him safe, but they weren't giving. I mean, he was turning. He was dead. Blue. He was not.
I was holding him like this, and he was dead. He was, and Bill just looks at me and says, "Can't you do something?
Or can you?
Or aren't you on that code team? Isn't there something you can do?" And then just like that, I switched from being freaked out mom to healthcare provider. Yes, I can do something. Okay. Heart stops beating. The only reason babies or children, when their heart stops, it's because they've stopped breathing. So what stopped his breathing? Secretions in the case of seizures. So now I know, I mean, this all happened in a second, but so now I know he's got so many secretions in his mouth that it's blocking his airway. So he stopped breathing, therefore his heart stopped beating. So I this isn't the way you're supposed to do it now, but I knew what was the cause. So I opened his mouth and just sort of pulled out with my hands as much mucus as I could. And then I flipped him over onto my lap and I just pounded his back a few times, give him a few good whacks to get whatever was there out, sort of like at an angle. And then I flipped him back and I gave him a breath to push whatever was there down. And then on my first compression, boom, he just turned red. All the color came back.
Oh my goodness.
And
oh my gosh.
and then he started crying, and it was the happiest and scariest moment of my entire life.
Oh my goodness.
Oh,
And I was sorry.
and
Oh
that's
my
a beautiful
goodness.
I mean, that's just
story,
an
though, that
incredible
you
experience.
could switch hats like that, and it made such a
It
difference
was
to
just
save
like
his
that.
life.
I was doing nothing. I was standing there hysterically crying and sobbing.
Oh.
And it just took Bill to say, you
Do
know how to
something.
fix this.
Yes.
Do something.
Do it.
Yeah, I
Do
did. I didn't
something.
realize it.
You did it. You did it. Good for you. Good for you.
You guys are an
So-
amazing team. Really, you
Yeah.
need each other so much because you needed that push, and you had just the wherewithal and the knowledge to get it done in an instant. I mean, it's just pretty remarkable that his one clause could make the difference in your action, that could make the difference in Everett's life.
Yeah.
Congratulations.
So I
to
guess
you.
maybe I
Thank
saved
you.
his life
Thank you.
twice now.
Really?
He owes me at least a massage, a foot massage.
Foot massage, right? He's a good massager.
He is a
Masseuse.
tremendous massager.
What other symptoms? What other symptoms
Mhm.
has Everett experienced?
Oh,
he's had
everything.
seizures.
Yep.
He's had, he has epilepsy.
We were in the
epilepsy.
hospital quite a bit
Yeah.
when he was young.
We used to say that we winter at Children's.
Right.
Oh,
Because we would be there
Oh.
days on ends,
For
even
weeks.
weeks. Right.
And actually, we think that the seizure he had was because we had only been out of the hospital for like 7 or 10 days. And so he probably had an hospital acquired meningitis of some sort, whether it was
Oh.
viral or bacterial,
my
that caused
goodness.
that seizure.
But
It wasn't a febrile seizure. You don't have febrile seizures like that. That was
right. So
that
he
was
would
different.
he would get RSV a lot,
Yeah.
and
I
then
see.
he had malformations in his lungs.
Yeah. So his bronchioles are all malformed. Instead of having like 3 smooth, one going to each lobe of the lung, he had 5 and they were all kind of twisted and tangled. And we didn't know this until later, but all he needed was one little gob of mucus to plug one of those tangled, and he'd collapse a lung.
Right.
So
And is
I
that
see.
common for BBS? Like for the symptoms that he has, are they fairly textbook? Especially I'm thinking
Yeah.
students listening, studying for boards, and thinking of Everett when they're taking their exam.
well, one of the ways they discovered BBS, and when I say they, I mean Nico Katsanis and Phil Beals, they found that a number of patients had switched. I don't know what it's called, like what it's like
When the organs
the
develop.
organs are like
Oh,
Reverse.
I know
mirror
what you're talking about.
imaged.
Sinus invertus, is that it? Something
I-
like that?
That sounds right.
Like your
But-
heart is on the different side.
Yes,
and
it's
different-
like
Yes.
exactly,
Oh.
but mirror imaged. Yeah. So, and that is that's caused by cilia. That's a cilia caused disorder. And I don't know that that's particularly common in BBS, but apparently they had seen it enough that it led them to start thinking cilia. And these are human geneticists doing their postdocs,
Mhm.
and they still are.
Finding new.
Phil Beals is the UK a person who knows the most about BBS, and Nico Katsanis has done so much research, and his team has done so much for BBS. I mean, they're the guys who figured it out, who found the first gene.
Identified the gene.
And we
First
were at a
change.
conference at Duke when Everett was 5. And at that conference, they took
Took a skin sample.
skin samples. Yeah, they
each of us.
punch biopsies
Mhm.
of everybody. And in the time we were there, in less than 24 hours from the time they took the punch biopsy to the Saturday afternoon, they had discovered 9 or 12 new genes
New genes, right?
Wow.
in less than 24 hours.
So what is that? However, it was then diagnosed.
Oh, so he was diagnosed actually, going back to chronological. So he had that epilepsy deal. He was always hungry, always, so many things about him that were just unique and that were just him. And, but we did always have to work very hard to keep his weight down.
Yeah, he would eat a full meal, and after
still be
that full
hungry.
meal, we would be like, "I want a snack."
Yeah.
I'm still
He
hungry.
just
Right.
ate.
Right.
And is this at what age was he?
Young, like
Right.
3-4 years old. Like he
Oh,
would,
really? That?
yeah, like
Yeah.
it was
Oh,
always,
yeah.
when they teach children sign language in daycare, because it's
That's
easier. Yeah, he would always do this.
More,
more,
more inside.
more.
Yeah.
Right.
Yep,
right.
it was always muh. He always wanted more. And so
we didn't
even
know.
from
We
then, even
just thought he had
before
a
he could talk,
Great
really.
appetite.
Yeah.
Well, how old is he now?
He's 16, almost 17.
Yeah, he'll be
And
17.
what's his quality of life now? That's amazing. He's made it to 16 or 17.
Yeah.
What's
Well,
his quality of life?
His quality of life in terms of the hunger really changed when he was 12 years old. 12 years, right?
Yeah.
He started taking part in a
trial.
free trial. He was patient 1 on a
Patient
phase 3.
001 because
001.
mom hounded the doctor.
Why is that not surprising?
Why is that not right? Right, exactly. Mom's just kept calling him and texting him all the time, being like, "Hey, Dr. Haas, when's phase 3 going to start?"
Right.
He's like, "We have to finish phase 2 first." So when it was time for phase 3, Everett was patient 001, and it was
a double-blind study.
It was double-blinded.
But we knew
And at
that
what
he was
point,
on
and
it.
how much did he weigh at that point? Was he obese at that point?
He was always chubby because
topping the
again,
charts.
we worked so hard.
We did.
Like,
yes,
we went out to eat once a week, and it would always blow waitresses' minds when this child would ask, instead of fries, "Can I get steamed vegetables?"
Right.
They'd be like, "What?
Right.
Who's this freak kid?" I mean,
Oh, parents are going to be asking you now, how can I get my child that doesn't have CPS to be ordering that, right?
yeah,
Right.
you just don't let them be the parent.
Right.
You can be the parent of your child. So you just don't let them have the fries, and you don't eat them either.
Right.
So,
right.
But
so he was put on some
wasn't-
kind of medication to
yeah,
curb his
he was
appetite?
always chubby and chunky, but he was never. I mean, he was probably classified as obese, but he wasn't as obese as
morbidly obese,
like these other kids that we see, and everyone's like, "What do you do? How do you do it?" And it's like, I don't know. We just make him not eat French fries. I sent him to school with like sandwiches with hummus and whole grain sprouted bread. I just want him to get nutrition, but not with so many calories. And, it's like the really thin bread. And
so food became the focus of his day.
But he's got your strength, because it sounds like he had the determination. He bought into it, and he went, never did he
to some
ever
degree.
Yeah. He would, he was sneaky.
Oh, yeah.
So he was allowed to pick from the school lunch menu. He could have school lunch once a week. So we'd
otherwise
let
we'd
him
pack a lunch.
Yeah. So I sent lunch with him, and then he would just grab a milk, and he was instructed, and the school knew too that he could only have the low fat milk. no chocolate, no whole milk. And so we would pull out the menu for that month, and he would pick what, items he wanted, what lunches he wanted. So like, I want the lasagna roll-ups, or I want, Italian dunkers, or whatever they are, these things. So, okay, fine. So you can have lunch once a week at school. Then one day he brought his lunch. I don't know, this maybe like 3rd grade or something. He brought his lunch home, and oddly, it wasn't entirely gone. There was a little bit of sandwich crust left, and there was a little bit of fruit left, and that was odd.
Right.
And then I was noticing, wow, because I was set up on auto pay,
right.
or like, so it auto would deduct. So whenever his school value, so the kids paid with a 4-digit code, so they were set up with an account. And then when it would get down to, it's like the iPass, so when it gets down to a certain level, it auto pulls like $30 or $20 or whatever from your account to replenish. And then I was noticing that there's been pulling a lot more than one lunch a week, and
right.
one milk or 2 milks a day, because he had one at snack time and then one at lunch. And then we realized, because he told us, he's very honest.
Lunches.
Right.
He was eating his lunch at snack time and then buying lunch
At lunch.
at
Right.
having school
So he
lunch.
was double. He was double.
Yeah.
Right.
So he was eating
So-
2.
End of part 1 of 2.
Thank you for listening to this episode of It Happened to Me. We encourage you to learn more at ithappenedtomepod.com. That's ithappenedtomepod.com. Please use the contact form on our website to submit your guest suggestions, comments, questions, ideas, and feedback for the show. You can also email us directly at ithappenedtomepod@gmail.com. Again, that's ithappenedtomepod@gmail.com. We would also really appreciate it if you can leave us a 5-star rating and review on your podcast app, probably Apple or Spotify. This helps others in the rare disease and medical challenges community find us. It Happened to Me is created and hosted by Cathy Gildenhorn and Beth Glassman. Steve Holsonback is our media engineer and co-producer. Myself, Dineen from DNA Today, is our marketing lead and co-producer. Ashlyn Enokian is our graphic designer. And remember, it happened to me. I'm not alone, and neither are you.